In sciatica chiropractic adjustment, the pain gets relieved. Sometimes you can't sit. Sometimes you can't stand. Sometimes you can't walk or drive, or even lie in bed. The pain is simply wretched. The reality is a lot of doctors fail to fix their sciatica patients. They return repeatedly with the same pain, the same issue, the same cry for help. The doctor eventually begins to wonder whether the patient even wants to get better. Diagnosis: sciatica. Pain relief. Doctors gave up fixing her sciatica, but today she feels brand new. After helping hundreds of people who suffer from painful sciatica and battling it myself when I was younger, I can tell there's probably a no more aggravating form of back pain. Sometimes you can't sit. Sometimes you can't stand. Sometimes you can't walk or drive, or even lie in bed. The pain is merely wretched. A couple of days ago, I've met a lady on her hands and knees. It was the only way she could find relief. She was in tears. The pain radiating down her legs was unbearable. The first thing you should appreciate is sciatica is not a disease. That's right. Allow me to be clear about this because it's important. Sciatica is not a diagnosis. Let me mention here that these opinions belong to Ian Hart, running a website called My Back Pain Coach. If you're seeing a doctor and telling you that's what you have, you're not being told the whole truth. Let's put it this way. Sciatica is a symptom. The doctor is only labeling a symptom. They're not telling you what is actually wrong. Now when they put a label your pain, I totally get how good that makes you feel at the moment. What happens next? They prescribe some heavy-duty ibuprofen to calm the inflammation, maybe ship you off to a physical therapist. Then they're on to the next patient. And you already know how that works, don't we? Let's face it. The reality is a lot of doctors fail to fix their sciatica patients. They repeatedly return with the same pain, the same issue, the same cry for help. The doctor eventually begins to wonder whether the patient even wants to get better. Imagine that. It doesn't entirely occur to them, it could be the treatment that's not working. And that's because their sciatica diagnosis just becomes an easy way of sending the patient home happy. Sciatica is the term that describes symptoms of pain that begins in the lower back and extends down through your butt, thigh, and sometimes as far as your foot. Most likely, that tingling or painful sensation going down your leg is caused upstream in your spine, such as irritating, compressing or pinching degenerative disc disease causing the vertebra to hit a nerve. A facet joint at the back of a vertebra that is out of alignment. A strained back muscle is spasming and painfully squeezing a nearby nerve or nerve sheaths. Well then, multiply these issues by the number of vertebrae and muscles in the back. You can start to appreciate how much work there is to accurately diagnose the problem, even with new technology such as MRIs. Which is why most doctors feel they're doing the best they can given the resources available.